Validation is good, but if you're receiving it continuously, especially from your therapist, that might be a red flag. Hi, I'm Maria Paula Bermeo, clinical psychologist, and on this channel we talk about everything related to, of course, psychology. So if you're interested, please keep on watching. Before starting this video, I want to remind you that I give in-person therapy. And if you're out of the city, I got you because I also give online therapy. So if you need a consultation, please feel free to reach me out on my social media, my phone number, my email. All of them will be listed down below on the description box as well. Validation is something people often look for in hopes to feel better and to feel safe. Many look for it from people like me, the psychologists, in order to improve their mental health. And sure, validating someone's feelings and emotions is key to help them to have an optimal mental functioning, as this study suggests. But as you can see here as well, it is for specific cases. As in other cases, for example, for someone who suffers from high emotional dysregulation, anxiety, or fear, it can be detrimental. But this is just the tip of the iceberg. What really is validation? Validation within therapy encourages and supports the understanding and acceptance of the client's experiences, both verbally and non-verbally. It signifies that clients are heard and that their behavior is understandable, even if not appropriate in their given context. Validation is part of the process that establishes the truth or validity of what is said in therapy. In other words, validation is being listened and comprehended. It means your therapist understands what is happening to you, so they'll be able to adapt to your own particular situation, but also help you discovering the root issue so you can address it and find strategies to heal, manage it, and don't let it influence your entire life. But if you still don't understand, here are some ways in which validation is applied. Active listening, remaining focused, attentive, and in the moment while maintaining eye contact. Mindfully responding, monitoring verbal and non-verbal reactions to what is said. Reflecting without judgment. Recognizing and verbalizing what the client is feeling, such as, I can see you are having a tough time at the moment. Being tolerant, even if not in agreement with the client's behavior, considering their history and how their thoughts and feelings may make sense. Showing that what they say is taken seriously, such as acknowledging that something happening sounds awful, offering a tissue, or asking, what do you need right now? Acceptance throughout the session is crucial. Restating what was said, summarizing and simplifying what is said, verbally and non-verbally, by the client by providing accurate reflection, such as, you think it is unfair that you do all the housework and you would like things to change. Focusing on behaviors, pointing out that the current behavior may be unhelpful and has not always worked in the past. Treating the person as an equal, seeing the client as an equal and showing them the respect they deserve. Radical genuineness, believing in the client's strengths and respecting that they are capable of change. This is what validation is in the clinical practice. Why am I talking about this with concepts and articles to explain it? Because nowadays society has another meaning of what validation is, which has made them go out of control. If you've noticed, individuals nowadays believe validation is agreeing with everything you say. Again, to feel safe, but the thing is, you cannot say yes to everything, otherwise you might be validating someone's distorted thoughts and making their issues even bigger than they already are. And sometimes validating even makes more harm than good, even when it comes from a good place, but some seem to don't understand that. I've seen many people saying that obesity and eating ultra-processed foods is healthy. Meanwhile, science has already proven that this makes your brain swollen, causes hormonal imbalances, increases chances of depression, sleeping difficulties, stress, ADHD, and more. However, people keep validating it and trying to tag everyone that tries to lose weight, watch what they are eating, and desiring to be thinner as fatphobic when that's not the case. I've seen others deeming fruits, breads, potatoes, and even water as toxic. How can I validate that if they are suffering from an extreme eating disorder and I need them to change? I've seen people supporting children that want to transition to a different gender gender despite kids not having enough comprehension of what sexuality really is, and how transitioning can affect their life long-term, physically and mentally. How come society says a 17-year-old should not be dating a 20-year-old because that is grooming and everything, but somehow a 12-year-old can decide to change their sex? This is a wrong application of validation and a hypocritical one as well. If I have an alcoholic patient that insists they need to drink to function, of course I will use a confrontation technique because I need to treat them harder than I would to other patients, because I want to guide them so they can change their dysfunctional behaviors. Yes, validation is a tool, but applying it in every single case is not ethical. Let's take a look at this article. Who can benefit from validation therapy? Validation therapy can be beneficial for a wide range of individuals, including individuals with dementia. Validation therapy has been found to be particularly effective for individuals with dementia, as it acknowledges their emotional reality and validates their experiences. Individuals with memory loss. Validation therapy can provide support and understanding for individuals experiencing memory loss. It offers a compassionate approach that focuses on connecting with their emotions and experiences. Caregivers and family members. Caregivers and family members of individuals with cognitive or emotional challenges can also benefit from validation therapy. It provides them with effective communication strategies and tools to better understand and connect with their loved ones. It's important to know that validation therapy is highly individualized and may not be suitable for everyone. It's recommended to seek professional guidance and training if you plan to incorporate validation therapy techniques into your caregiving approach. Unfortunately, not only people on the internet, but even colleagues of mine tend to do many errors, and these professionals on my feed post over positive, over validating content on social media as well. Maybe without realizing that over validating is falling into coaching territory instead of real psychology, which is not a contribution for human development. And because of that, if people find someone like me that does use a variety of techniques to help you to open your eyes and actually help you to improve, we are seen as bad, as harsh, as not empathetic, when in reality we actually are. And that is why we confront you, because when doing that, we can help you to open your mind and restructure the thoughts and behaviors that are burdens in your daily life. I've had patients that after a session in which I confronted them, they might leave feeling mad at me, but then in the next sessions they tell me, "You were right, your words resonated on my mind the entire week, and I really needed to hear that to realize that I'm not having the best behaviors and that I need to change." And that allows both of us to work in a better way and get better results that last long term, which doesn't happen if your therapist is supporting you and agreeing with everything you say every single time, because again, that is more like coaching, not therapy. That is more like talking with a friend that will give you a biased advice instead of a psychologist that should give you neutral guidance. So next time, if you find that someone in your life, especially your psychologist, is validating you way too often, please reflect and analyze if they are really coming from an objective place, or if that is not making you any better and instead might be a red flag. Is there something new you learned from this video or that you would like to add to the conversation? Leave a comment down below. Also, don't forget to like and share with someone that may need this. And don't forget to subscribe to the channel so that you never miss out for more interesting psychology content. Thanks for watching.